the whole question about Bodeket. The Bodeket is a very new issue, and we'll speak in a minute why it's new, what happened, why we necessarily have Bodeket with them in the past, what is their role. But I'll start with a few Ma'aseh Shahoya, things that happened, places that we had with the Bodeket. I'll tell you the first story. There was a Bodeket in Ashdod that there was a Rav there in the area that sent a woman to the Bodeket. Had a Bodeket was problematic. He sent a woman to the Bodeket, and the Bodeket looked at the woman. There was nothing, didn't find anything, didn't find any pizza. Went back to the Rav, and she said to the Rav, I didn't find anything. And Kolba said, there's no pizza. So the Rav sent the woman back to the Bodeket and said, you're going to find a pizza. So the Bodeket called me, very, very distraught, and said, I don't understand what the Rav wants. What's my role? Is my chobat to find a pizza? I'm a Bodeket. I just said what happened. So that's the first case. The second case that we had was a woman who went to the Rav. The Rav sent her a Bodeket, and the Bodeket said to the woman, a Torah. She didn't say what she saw. A Torah, you're okay, you're good. So she went back to she didn't get back to the Rav because she said it Torah. Kol Beseder, so I don't know if we go back to the Rav. So then later she went back to the Rav, called her up after a day or two and said, I went into the Bodeket. What was the tshuva? So she had already got an answer. Like, who gave me answer? The Bodeket. Already got an answer for the Bodeket. Okay, she went in. So the Rav calls the Bodeket and said, tell me what happened. Said, I'm not after a report to you. I'm not answerable to you. I gave the woman the answer. That's it. Third case that we had, third Ma'aseh Shahaya, that a woman went to the Bodeket. Sorry, she went to a doctor. She comes to the Rav and said, I went to a doctor. The doctor didn't see anything. The doctor said, I ain't pizza. So she went back to the Rav, and the Rav said, I got over Bodeket. She went to Bodeket, and the Bodeket finds a pizza. The dog didn't find a pizza. How is it possible that the Bodeket found a pizza? So there's a stira. It doesn't matter. That was the one case. And another case which is similar is that a woman went to the doctor, and the doctor checked her and said, there's no pizza at Tumeya. You're nida. And this is the case now, this afternoon, almost an hour ago, with a woman who went to the doctor, and the doctor said to her, she did a particular procedure, and the doctor said, one second, and the doctor said to her, you're nida. From what the case that I heard, the woman's not nida at all, but the doctor says she's nida. So then she went back to the Rav, and the Rav said to Bodeket, and the Bodeket said, there's a pizza. So what's the din of the woman? At the end of the day, she felt on herself, and he needs tmeah. The doctor said, I need tmeah. So she's tmeah. But only after she went to Bodeket, okay, so what's the koach of the Bodeket to change the medical reality? We know that she didn't have a pizza before, but she didn't have a pizza. So that's the shayla. The whole question of Bodeket is based on a Gemara. The Gemara Masechet Nida, Samafal, says that Ne'emenet Isha Lomar Makkah Ishli Boto Makom. Machloket in the Gemara. Rabbi Shimon Gamliel disagrees. Rabbi Shimon Gamliel says, no, we don't hold like that. We don't hold that a woman is Ne'emenet Lomar, and therefore she has a matkat Motzi Adam Yasura. But Hachamim hold like the Pshat Rabbi Yehuda that Ne'emenet Isha Lomar Makkah Ishli Boto Makom. And therefore, if a woman says, I know I have a pizza, you muter it. I.e., is machloket already in the Gemara as to whether a dam from a makkah, a dam that comes from the uterus and is but as a result of a makkah, not as regular menstrual bleeding, there's a machloket in the Gemara as whether she's tmeah or not. The Rav Shimon Gamliel holds she's tmeah, and the Tanakama and Hachamim hold she's not tmeah, that she's Torah. But the Shulchan Aruch says, we know that we have a makkah, so the makkah is motzi adam, that a woman is muteret. We hold that the makkah, the dam from a makkah, is matir. However, the Rama, very famous, Machlokes Shulchan Aruch and the Rama, the Rama is a little bit more complicated. The Rama says that if we know it's motzi dam, then the asura, if it's not, she muteret, but lo bizman vista. But if it's zman vista, if it's a zman that she's anyway supposed to see dam, so even if we know that it's motzi dam, we still asura because we still have a suffix doraita as to whether she is mutared or not, whether that dam is considered to be dam maka or not. And we can also somech, as we said on the Gemara, that the Gemara brings a whole machloket as to whether we say that dam maka is mutar asu. The next sif in the Shulchan Aruch says that sif Vav, if I'm not mistaken, sif Zayin says that nemeni dishalomah makal yesh matomah. Just to think about that for a moment, what does it mean nemeni disha? How can an isha say yesh maka? We're talking again not about a makkah. Look at when we see the matzeket, you'll see that we come with a map of the uterus, a picture already of the uterus that we've already seen many, many times. We all know it Balpeh. We can wake up in the middle of the night and we can describe the uterus, hopefully. That's talking about a bleeding from inside the uterus. How can a woman know that? How can a woman possibly know that there's bleeding inside the uterus? The answer must be, and that's the horror what most of the Rachronim say, that in the time of the Gemara, women were much more conscious of what was going inside their body, that a woman could say that I know that it's bleeding or not bleeding. She didn't know 100%. That's the horror of the machloket in the Gemara. There's a machloket between Shulchan Aruch and the Ramah. She didn't know 100% that all the bleeding that she saw came from the dam, from the makkah. She couldn't ever make that a kavir, but she knows that I have a bleeding, and therefore the next sif is that we know that the woman said I saw blood, and therefore her feeling of her blood, that she knows that that's not Zman Vista, if we go with the Ramah. Or the Shona, the Hor doesn't make that distinction, but the Hor, the Pshat of the Ramah. And that we know she can basically say, I know that it's something different. So the Chorah, that's the basis for Bodeket. The Bodeket is, at that point, the shlicha of the woman to come and say. The woman doesn't know, because our women, Eilem Halkasha, we don't know that the difference to make a distinction between Dam Nida and not Dam Nida. And the Ramah says that if Dam Makah and Dam Nida are the same, it doesn't help us. It's only because Dam Makah is different than Dam Nida. Would we say that it's not a problem? However, if it's Dam Nida and Dam Makah are the same blood, they come from the same source, i.e. that we made a Chatach, that we made a Makah in the endometrial lining, therefore biologically they're the same. So the Hora, the Bodeket, is coming to say, what does she say? She says, I saw a Makkah. She says, I saw a Makkah, but we just said that Makkah is a machloket, and maybe it's the same blood. The Tshuva is not Peshuta. The Bodeket is talking about a completely different situation that the Gemara is talking about, and that the Shulchan Aruch is talking about. The Shulchan Aruch is talking about uterine bleeding that comes as a result of a Makkah. We spoke about that already. We spoke about medical procedures, which of them make a woman nida, not a woman nida. We spoke about the idea. We spoke about the machloket in the Chazon Ish, between the Michtav of the Chazon Ish and the Psak of the Chazon Ish. All that is talking about uterine bleeding. When we're talking about vaginal bleeding, it's a bad idea that a woman's mutter. Bleeding from the vagina is exactly shaveh the bleeding from the nose. If a woman have a nosebleed, no one would say she's tumeya. Why? It's clearly that blood is not dam nida. It's clear that it's not a problem. The same would be with bleeding from the vagina. Vaginal blood is vadai 100%, not dam nida. Lo yachol liyot. So when we always get excited, the woman says, I know I have a makkah because I felt discomfort, or I felt pain, I have a long fingernail, I have dry vaginal, I don't have vaginal secretion, I did many bedikot, whatever it may be. That's bichlal not what the Gemara means. The Gemara, when it says, it's not talking bichlal about vaginal bleeding, it's talking only about uterine bleeding. Because it was barur vadai to the Chochmei Gemara that any vaginal bleeding the woman would never be needed. So if we go back to the old poskim, we go back to the Haim. I wanted to bring a picture. I don't have a picture of my Zayda, but you bring a picture of your Zayda, anybody's Zayda here. So he would vadai that he never sent to a Bodeket, right? Some didn't send a Bodeket because they weren't Rabbonim, and some didn't have a Bodeket because it wasn't a Bodeket. Why didn't my Zayda have a Bodeket? Because the woman didn't need it. The poskim of Zmanam didn't need to have that Bodeket. Why? Because they were able to make that Avchana. There's a story. The next picture is a picture of Rav Eliyahu at the Kotel. There's a story of Rav Eliyahu. The Gemara says that the closest blood, histologically, to human blood is dam yonah, bleeding from a dove. And so the story goes, he was never there, but that's kach mesaprim, and alai lo mesaprim sipur only about Rav Eliyahu. But the Rav Eliyahu was once, they wanted to check how much of he has Yeruach HaKodesh. So they brought him dam for Bodeket, for dam Yonah. He looked at it and said, it's a dam Yonah. And they sent him away, but Boshet Panim. So Rav Eliyahu could make that distinction. He knew that it wasn't dam Nida. Okay? There's a story of Rav Fisher. Rav Yaakov Fisher, the brother of Rav Shlomo Fisher, died recently. So Rav Yaakov Fisher was the head of the Badat quite a few years ago. So the story is also a woman came to him and she saw all the time Bodeket. She saw bleeding on Bodeket. And the woman, she came to Rav Fisher. Rav Fisher said it's from the IUD. What do you mean from IUD? I don't have an IUD. I have 10 children. I don't have an IUD. He says, you're bleeding from IUD. He says, Lo yachol liyot, lo yachol liyot. He said, yeah, you've got an IUD. It's bleeding from IUD. Okay. So she went to the doctor. Says doctor tells her, you have an IUD? What do you mean have an IUD? I never put an IUD. So the story is told that she went to a doctor and the doctor said she already has 10 children. It's enough. She's not so well and she's not so has difficult pregnancies. So the doctor was a Rahman and he was a Bal Chesed. On his cheshbon he put in an IUD. And she never knew about it. She wouldn't know about it other than Rav Fisher saw it on the Bodeket. So if you're on that level of idea of dam, you don't need to have a Bodeket. I know that it's dam from the vagina. So then you don't need to have a Bodeket. However, we do need to have a Bodeket. So that's, I think, that the halachic basis of the Bodeket and why historically we have Bodeket and in the previous generation, no one ever spoke about Bodeket. Bodeket is a completely new idea that never appeared before. It doesn't appear anywhere in the Shulchan Aruch. You have to have Bodeket. Unlike Agav, the Gemara, there's one place that the Gemara speaks about, the Shulchan Aruch speaks about, that a woman who's blind has to show her Bodeket to Chavirta. That's talking about something completely different. That's not a Bodeket. That's talking about that the blind woman doesn't know, she can't see. So she has to show someone who can see. She has to have a seeing person, like seeing eyes. That's talking about different case than with that the Bodeket. The Bodeket is going inside the vagina and actually doing the. So what is not the role of the Bodeket? When we say what is the Bodeket, what is her role? What is not her role? Before we speak about what is not her role, we'll speak about what is not her role. So the first thing, she is not a poseket halachot. That's not a job. In the case that we said before, that the Bodeket said to the woman, you are a Torah or Hafef. Hafef, she says, you're Nida. That's not her role at all. I had once a Bodeket that said to me, the woman's Nida, and then she started arguing with me about halacha. I said, Kol hakavod, I'm not interested in your psak halacha. I want to know what you saw. Your psak halacha lo manil. I'm not going to argue with you on a halachic basis at all. That's not our job. That's not our respective jobs. It's for me to argue the halacha. She's not a poseket. She's also not a finder of a petza. She's not a creator of a petza. So she can't take something that doesn't exist and say, yes, it's a petza. She has to see what's going on. She doesn't create the petza. Another thing is she's not a doctor. She cannot give a medical advice. And she happens to be a doctor. You could have someone who's a bodeket and a doctor. We'll speak in a moment why that's problematic. But she's not a doctor. Therefore, the fact that a woman went to a bodeket does not mean that she doesn't have a medical condition that needs treating. Let's give an example, and we spoke about this before, a pap smear. A pap smear, its job is to look at the cells on the cervix, exactly the place where the bodeket checks out, what the bodeket looks at. And the cells there, if we see that they are beginning to be cancerous, then we need to deal with them. Now, it's very possible that a bodeket may see on the cervix cells that are questionable. And if she says, you have a petza, it's all okay. So she means it's all okay halachically, not medically. And therefore, it may well be that there is a medical condition that needs to be treated, that needs to have attention, that the bodeket could mask over. We have to be very careful not to do so, and not to understand from the bodeket that there's no medical problem. She's not a doctor, and she happens to be a doctor. But if she's a doctor and she acts now as a doctor, that's different a role of the bodeket. So you can have a person who has many different taskirim, but her role as a bodeket is not to give a medical advice. She could say, there is a mimsa, I saw something that maybe needs to go checked. That is appropriate. But her job is not to come to give a medical suggestion. The other thing she's not, and I think this is very, very significant, she's not the shlicha of the woman. Many, many times, I've had this very unfortunate experience that women saw ketem on the Varshalom Kabel Tuma, or they saw a ketem on the Pachot Migris And at Al Pi Halacha, there's absolutely no question that the woman would be Torah. There's absolutely no question that there would be no reason for us to say any chumrah, any way to say that a woman's asura. Why? We have a sfeik. What's our sfeik? Any ketim, we have a suffix. Safek barba hagasha, but safek lo hagasha. And even if it's barba hagasha, safek memakor, safek lo memakor. And therefore, any ketim that we see, we have a sfeik. And therefore, that's why it's a din derabanan. Mishnah Mufresh in Masechet Menida. The Rabbi Akiva says, what do you think? Amru hachamim ktamim lachmir, amru lakel. They said that the whole din of ketim is a din lakel, and therefore they were making because it's a suffix, it's a sfeik. However, the woman then, instead of going to the Rav and saying madini, and the Rav saying you're muteret, because it's a ketem on the vash shalom kebel tuma, or it's a ketem b'chol migris, or it's a ketem on the vash tzivoni, or whatever other reason, and the many reasons that we know of halacha that we're matir ketem. Instead of that, she runs to the Bodeket. Why? Because once the Rav sent her a Bodeket, or she heard from her friends of Bodeket, or she heard about this thing, this wonderful role of a woman of Bodeket. She goes to the Bodeket, and the Bodeket sees dam coming from the uterus. No petza. He comes back to the Rav. She says, I went to the Bodeket, and the Bodeket saw dam coming out of the uterus. Dina is chad mashmi. He asura midoraita. Asura midoraita. Why? Because now I don't have a fake. Now I saw that there was dam coming out of the uterus. Once it's dam coming out of the uterus, it's not a din, it's not a safek, it's only safek echad, it's not safek. Because now I know it came from a makor. Now I know it came from the makor. Now it's a question whether it came from baragasha or no baragasha. And since we saw it on Bodeket, I can even say even that it came baragasha. If you want to say it's not came from the makor, it still came baragasha because we saw it on the Bodeket inside. Therefore, ivadai asura. That woman, had she gone to the Rav before and not gone to the Bodeket, would be Tahora. She went to the Bodeket. She's now Matme'ah. It's very, very important to make that point. And it's very important that when we speak about Bodkot and we machshir Bodkot and we put a Bodeket in our community, it's very important to make it clear that the Bodeket is not the shlicha of the woman. There are times when I can use the Bodeket, l'tovat ha'isha, but she's not the shlicha of the woman. She's not the woman's emissary that's going to come and help her. But she's in many times they're going to Bodeket yikalkelet ha'isha, and that therefore the Bodeket has a different role. That's what the Bodeket is not. Ma'od chashuv to remember what a Bodeket's role is not. Every person in any job, if we're rabbanim, we should know what we're not. We're not doctors. We're not psychologists. We're not lawyers. We're not v'chule. With lots of things we're not. Many things we are, but that's not what things we are. And so the important thing with the Bodeket is to remember what the Bodeket is not. What is the Bodeket's role then? I think that I would say that the Bodeket's role is birur hametziut, or if I wanted to say it in a more specific way, she acts as the einayim of the Rav. Let's imagine the situation. A woman comes to you with a bedika. The bedika is problematic. What do I see in it? I see dam. But I think maybe it's a petza. Now there are times, as we said before, that I could say it's a petza without eating bodeket. There's no din in Bashulchan Aruch. They have to send a woman to a bodeket. Lo kayam, lo b'Shulchan Aruch, lo b'Rambam, lo b'Gemara, lo anywhere. There's not a din anywhere. They have to send a woman to a bodeket. It's a big ta'ut. We think every woman sees a petza has to go to bodeket. A woman can say, "Nemendi shalom alam akash komakom." That's talking about the uterus, but die from the vagina. So if I know it's a petza because of the way it sits in the bad, because of the color, because of its location on the bedika, for many other reasons, then I would say in such a case, the woman is Torah. Why? Because this blood is not dam nida. And as we said, bleeding from the vagina is like bleeding from the af. A woman would come to you with a nosebleed. It's vadai that she would be Torah. It's vadai she wouldn't be Tameya. It's a pashut, not a shela bichlal. And therefore, we would be able to give the psak that she's okay. Why don't we do that? Because I don't have enough information. There are times that I ask the woman, did it hurt you? No. Do you have long fingernails? No. Did he do it quickly? No. Was it dry? No. So now I don't know exactly. I don't have enough information to give the answer. And therefore, in that case, I can give the option of going to the Bodeket. The Bodeket will give me information that is missing from me. She'll be my eyes. If it was Patet Bichlala Havamina, that if we didn't sneeze and we didn't have many other dinim, so I would look inside. I would say, show me, I can see. This is what I see. I can't do that. Baruch Hashem. I'm not a doctor. I'm not a gynecologist. And therefore, the role that I say is that Bodeket has to see that. The Bodeket comes and says, this is what I saw. And therefore, the Bodeket acts in a very, very crucial role. The Bodeket's role is now to be the Shlicha of the Rav. She's not the Shlicha of the couple. She's not the Shlicha of the woman. She's the Shlicha of the Rav. She gives information to the Rav that will now enable the Rav to give a psak. That is the role of the Bodeket. Nothing else. The Bodeket doesn't come to tell the woman her din. She's not the poseket. She's not giving the answer. She's, even if she knows, even if it's barura keshemesh, that it's a petza and therefore the woman's muteret, the role of the Bodeket is not to give that information. The role of Bodeket is to relay that information to the Rav, and the Rav will then give a psak. There are many times in which there has to be a correlation between what the Bodeket saw and what the Rav saw. The Bodeket doesn't always see the Ptika, who doesn't always see the Mimsa, doesn't always see the Ketem. And so it's very possible that the Bodeket will see something and will say it's a Petza, but when the Rav gets that information, he will know that's having, that even though that's the case, there's still not enough, that the Petza isn't significant enough for what I saw. It's not every single time we see a Petza, we know that definitely the woman's Torah. That's the important one. I'm going to take a break until get inside. With Baruch Hashem, we're able to get home, and I will continue in 1 minute. Give me a second. Okay, Baruch Hashem, we're back. Okay, we're home. Baruch Hashem, everything's good. We're back safely. There's a terrible accident on the way. Nora. Okay, so we said that Bodeket's role is to be the rabbi's eyes. She clarifies the situation. So you tell me what happened. What's the Metzias? And she's the Rav's Slicha. There's another secondary role, and when you see the Matzeket, you'll see it's on a lower level. It's on a lower line. That she can also put able to function. So what can we do? So I said the Bodeket can perform the hefsek and the bedika. So machloket in the poskei zmanenu as to whether in that case that the Bodeket performs the bedikas, whether she has to actually take a bedika cloth and put it in, or is it sufficient that she can just look inside? And can you see? The Chasam Sofer says we have to know once a woman knows that she can see that inside it was okay. So then, excuse me, then we don't need to see that, we don't need to actually do a bedika. The bedika is only the birur, the mitziyut, that we couldn't see. So that's the question, whether the bodeket is sufficient when she does a bedika, that she can just look inside. So some poskim say like that, but most poskim say she can take a Q-tip, or she can take a bedika itself and do a bedika.
There are cases, let's say that a woman mamash can't do any bodikot at all, and she has to go to a bodeket. So we tell her, go to the bodeket on day 4 or 5 of the end of your period, go there before Shkia and do a bodika, and then wait until after Seder Kochavim and do another bodika. Why is that? The first bodika was a hefsek. The second bodika is already day 1 of the Shiva Nikim. But the Evid Gadol will agree that the bodika done at night is okay. We spoke about it already. And we'll also say that even a bodika that was done at night before can be considered a bodika of day 1. Such a woman, therefore, would only have to come back on day 7. And she'll do a bodika on day 7. And therefore, she'll only basically have to go to 2 visits to Bodeket, and she has Shiva Nikim. So that's another role. But that's not really the role of Bodeket. That's a secondary role that the Bodeket can perform. What is the profile that we look for in a bodeket? So in Israel, it's a little different than America. In America, every state is somewhat different as well, and I'll explain in a moment why. In Israel, they have to be gynecological nurses. And the reason for that is that the bodeket's job is to insert a speculum inside the vagina. In Israel, legally, the only woman that can do that, the only person that can do that, is either a doctor or gynecological nurse. A regular nurse can't do that legally in Israel. In every state in America, it's somewhat different, that law. So some places you can do a regular nurse, some even not a nurse, some it's a medical practitioner, whatever it is. So every state is a little bit different, but it has to be somebody that can do that role. So what it is in your state is irrelevant for the din, but whatever it is, that's what she needs to be. That's what the bodeka needs to be. The bodeka needs to be in Israel. It's a gynecological nurse, and in New York, it's a regular nurse. So it has to be a nurse. She can't be a nice person. Maybe it is even not necessarily a nurse in certain places. In which case, whatever it is, but you have to know that law. They then have had extensive training. The training takes 3 levels. First thing is they need to know the halachic basis for the bodeket. So when I gave a whole course with bodkot, and we went through a lot of sugyas of different colors, different types of color, and what is a petza, and what is not a petza, and the din of nemenidi shalom and what is the din of efsek and shivanikim, and what is the minimum she needs to do. Mamash went through a very serious course, and they should know halachically. Don't just say you're finding a petza. The second thing they did is a medical basis for the bodeket. So there are, even though you're medical gynecological nurse, there's still things that are medically she needs to know. She's not so conversed in seeing different medical conditions, and to identify when a medical condition may be significant and may be a significant issue for the woman that she needs to know. She can't ignore it. And therefore, she needs to have the medical basis right. It's a little silly. You think it's a little strange to take women who are already working in medicine and to teach them. Taminali Shaveh. There was a lot of information that I didn't know, a lot of information you go back. And also remember things that if you were a nurse, it's already been practicing for 10, 15 years. So already there are things that change. The things that in medical practice, they change. We have in America, in medicine, something called, continuing medical education. So there are things that develop, that whatever I learned in medical school is passionate anymore. And the third, which is the most complex stage, and I'll explain in a moment why, is they have to do practical training. You have to have stage. They have to have a residency in which they do bodikot. And the way why that's complex is it needs to be with somebody. It can't be with me. I never done a bodika. It can't be with a doctor, because the doctor, again, doesn't always know what they're looking for. So it has to be really with another bodeket, or with somebody who knows what a bodeket is looking for. Now, the problem why it is very, very complex is, first of all, there's not so many bodkot, and not very many bodkot that are able to teach. And the other thing, and told me Miri Sprecher, who's one of the women is originally from Los Angeles, that she does a lot of the training. She started doing a bodeket many years ago. She does we work very closely with her. Rabbi Siegelman and myself met with her, in fact, in order to set up a bodeket training course in America. She said the following: a woman, I have, let's say that a bodeket gets 1 woman a day. Okay, then after that's what she got, 3 women a day. Okay, we will be crazy. Mamash, a very, very heavy, very, very busy bodeket, 3 women a day. Okay, of those women, the 3 a day, so the 20 she sees a week, 19 of them have regular situations. She has a bodeket. She has a spetzer on the abrasion on the cervix, and lecha baita. You see that? Yeah, that's it. It's finished. No. The problem is that the bodeket trainee is now going to sit with this woman. How many times are you going to be there? She goes there twice a week. So she sees now 6 women a week for 8 weeks. Okay. So she's seen 6 women times 8, right? She's seen 50 women, let's say. The whole time she was there. It's a lot of women. But every time she's seen, has been a regular, normal case. And of the 50 women she saw, 1 woman had some cervical erosion. That was, a big, aggressive thing. But the woman who's the bodeket, the trainer, over her lifetime will see many of those difficult situations. So many things that are complex. To see what's a petza, you don't need to have staj. That's clear. It's a pashut. If you don't know that, but the problem is to see things that are abnormal, that are unusual. And then she's not going to see so often. That's what Sprecher told us. That really, to really be effective, she'd have to call her when she has something special and say, come in. It doesn't happen. So that's a problem with the training. And the problem is that we are very concerned that the bodeket should see or may see things that are that she's missing, that have a medical significance, and maybe even some level of, beyond that. The bodeket, I say two issues about her job. One is, what does it mean? What does it entail? It's inserting a speculum. We've already spoken about a speculum before, and you'll see pictures of it on the PowerPoint that I will send you at the end of this year. The speculum is a piece of plastic that enables it to see, and basically what we're looking for is abrasions on the cervix. That's mostly the problem, because that's mostly the things we can't see. If it's clearly an abrasion in the beginning of the vagina, the woman A would feel it probably, and B, you see it's on the adim, it's going to be the beginning, unless it's talking about ktamim. And ktamim, generally, we don't need to send to a bodeket, because ktamim generally not so asur. We just put them, see it on sivoni, or see it on the loma kebel tuma, and she's going to be okay. Generally, it's not a problem, though. Generally, the problems are when we're talking about is it enough to just saw a petza, or is it also we need to see that the secretion from the uterus is also naki? So we say again, what we want to find is not that she had a petza, but that the petza is somehow related to the mimsa, to the piece of evidence that we have. Let's say a badika cloth has to be connected. So just seeing a petza doesn't help me at all. I need to know, in addition, that the secretion from the uterus was clean. So when I go, when having interaction with a bodeket, there are 2 things that I do. The first thing that I really like is the bodeket calls me in the middle of the badika. I send a woman to a bodeket. The bodeket calls me up. The woman is here. What do you want me to look for? So tell me, does she have a petza here? Do you have a petza here? She looks. She can tell me. Okay, can you do a badika? She does a badika. She shows me. That's achito. The second thing is she writes a letter. She writes a letter. The letter says, Mrs. Cohen came to me on such and such a day. I checked her. She draws a picture of the cervix, and there was a petza here, and there was a bleeding here, and the secretion from the uterus was clean. And she has a letter now, a te'ud of this is what you saw from the bodeket. And I say to every woman who brings me that letter, keep that letter kevavat enech. Keep that letter very secure. Why? Because that letter is not only relevant for today, that letter is relevant maybe for another 2 or 3 months. Because if we saw a petza in the past, it's possible that we're still going to see it again. So if you see the same event happening again, I don't necessarily have to send back to a bodeket. It's a tircha, it costs money, and it's a tircha, it's not so comfortable. And we have that letter that's basically a ti'ud of what we saw. That is very possible that we could use that could be very useful in future months. So those are the 2 things said about a bodeket. So we saw, and we go back to the cases that we said at the beginning. The second case, the woman who says, I don't have to report back to the Rav, is not true at all. Of course, she has to report back to the Rav. The question that the bodeket has to find a petza, clearly that's not her role. That's not the role of bodeket. The role of bodeket is to tell me what you saw. And if you saw it, there's no petza, there's no petza. That's it. The woman's male. What can I do? There's a malasot. So what's the difference between, and the last two cases that we said at the beginning of the class was that there's somehow a discrepancy with what the doctor sees and with what the Bodeket sees. And many people say, yeah, but it was a from doctor who saw me, the doctor they knew. So I think there's a very important distinction, first of all, between a from doctor is still a doctor. I can be very from, but I'm still looking at you as a doctor. I'm not looking at you as a halachic description of your situation. And I think it's very important. I said before that I had a case today that a woman went to the doctor, and the doctor said to me, how can a doctor, I said to the Bodeket who called me, how can a doctor possibly say that's not a role of the doctor? I couldn't say you have cancer because I look at you, or you have PCO because look, I can say this is a chashush, this is a chashash. There's a question of whether you have a problem. You have to go back to your doctor and have this checked out. That's very legitimate. The doctor can say this is bleeding, this is problematic, it's coming from the uterus, and therefore it may be tumor. You have to go back to the Rav. That's perfectly legitimate. That's giving me information. So a from doctor is not always the solution. But yeah, I went to a from doctor. It could be from male or female doctor. It's irrelevant. That's not always a solution. The difference between when we're looking as a doctor, looking at the Bodeket is very, very significant and very pashut. The question is there a clinical significance or is there halachic significance of the finding? I can see something, let's say that a doctor says, I don't see a petza, and the Bodeket finds a petza, so you're going to tell me one of them is lying. One of them must be lying. Either the Bodeket's lying or the doctor's lying. The answer is neither of them is lying. They talk about two completely different situations. When the doctor says there's no petza, what a doctor means is there's no abrasion inside the vagina that has clinical significance. There's nothing here that has any medical relevance. And therefore, medically, we don't call that a petza. There's a medical definition of petza. That's the thing. However, when a Bodeket says there's a petza, she's not talking about a medical condition. We just said before, the role of the Bodeket is not to be the doctor. The role of the Bodeket is not to say, I'm a doctor, and I can tell you what is the halachic, what is the medical situation happening. In fact, it's very problematic to do that. Because it's very problematic. It's very possible that the Bodeket will miss out important medical information. So therefore, we're not talking about medical information. We're talking about halachic significance. And we know that halachic significance and medical significance are two completely different things. And therefore, medical significance is that someone needs to be treated medically, has a medical impact. Halachic significance is, here is a petza that can explain the reason why blood was found on a bedika, on a specific information, a specific finding. And therefore, halachically, the woman's not tamei. It's no significance about the medicine at all. And that's why many, many times, the woman will go to the doctor, and the doctor says, no petza. Or afuch. It must, or you have a petza, and they go to Bodeket, because there's not. It's more the opposite, it's more the former than the latter. The reason is because it's talking about two completely different things. There's also, I would say, in addition to that, many times we have this case, that a woman says, it happens specifically during pregnancy, but not limited to pregnancy, that a woman says, I had bleeding, and I went to the doctor, and the doctor said, it comes from the uterus. Okay, so you're going to tell me now, from what we said before, half an hour ago, that Medina, if I see blood coming from the uterus, the woman's tamei. It doesn't matter whether the doctor saw it, the rabbi saw it, the Rav, the woman saw it, or the Bodeket saw it. It's irrelevant. And therefore, once the doctor says, I saw blood come from the uterus, the woman's tamei, ein lanu ma lasot. The answer is, lo chen hadavarim. And I'll tell you why. Because what the doctor often means in that case is, a woman comes, let's say, we just said that the woman comes and she says, I'm bleeding during pregnancy. What does the doctor want to say? The question the doctor has is there something in the vagina that explains that bleeding? The answer is no. Therefore, where must it come from? It must come from the uterus. It's often not, it could be, but it's often not that the doctor saw bleeding coming from the uterus. And therefore, it's a hashara. I have the same hashara. I know, this is machlokes achronim, but generally we make it on that if I know the bleeding comes from the uterus, I'm still makel if it's on devar shalom mekabel tuma, b'chol migris, etc., etc. The Siddur Torah is machmir on that. He says that we have to be, if we know it's coming from the uterus, then we have to be machmir. But generally, that's not our psak. Generally, we don't hold like that, and therefore, the woman is Torah. i.e., the fact that the doctor says it makes 100% sense that it's coming. If it's not coming from the vagina, it must be coming from the uterus. That's 100% correct. That has no halachic significance because I knew that to begin with. And we go back to loma leva loma rid. The doctor's information is irrelevant now. It doesn't change anything that I said before. I know before it probably came from the uterus, zenachon, and I know now it probably came from the uterus, zegam nachon, and I know that what she saw is loma kabel tuma. That's that. So it's very important to make that distinction. I think that distinction is somewhat lost in our rush to send everybody to Bodeket. It's avel because at the end of the day, there's no reason to send most of the women to the Bodeket. And we say, but what's the role of the role of the Bodeket as opposed to the doctor is very faded. And we say, but I went to the doctor and the doctor said no petza. This is gamlo nachon. So there's a very, very, very important distinction. The question then becomes, what if there's no abrasion found? We find no petza. Is the woman definitely nida? Can we say that if a woman saw her, we just said, ketim, and and we don't find a petza, the woman's mutorah. The fact that there's no abrasion doesn't make a woman nida. That's lo appear of if there's an abrasion, then we're more makel. Remember that again, the Shulchan Aruch is talking about abrasion inside the uterus. Abrasion from the vagina, loma leva loma rid, is from the birds. That bleeding is ephes. But even if we have, as we just said before, a svara dika to say that really the bleeding is from the uterus, which makes a lot of sense. The bleeding is from the uterus. Then, still, bedina, we're going to matir the woman. So that's a problem that I think people find it difficult to get their head around. They find it difficult to get their head around the fact that, but it's bleeding comes from the uterus. The doctor saw bleeding in the uterus, or the doctor didn't find an abrasion, and therefore he said it must be from the uterus, or the Bodeket said, or the Rav said it's irrelevant. That doesn't mention the din. The din is the firova poiskim that even if we know that it comes to the uterus, a woman's still Torah. If it's bedin, it's Torah. So therefore, we can't say that if I don't find a petza, it's asura. We shouldn't send it every single woman to a bodeket. The other thing that's very important is we saw that between the doctor and the bodeket, it also goes afuch. That is, if there's a medical problem, it is the obligation of the bodeket to alert the woman to say, go to the doctor. Go to the doctor. I think there's a problem. Don't be alarmist. We don't say, gaval, you have cancer. But we should say there is something here. That's a question. I need lawyer that. I'm not a doctor, but it's important that you should go to see a doctor in this situation because this is a mimsa that needs to be looked at, has medical attention. So therefore, if we conclude a little bit about the role of the bodeket the Rav must send the woman to the bodeket. It has to be not the woman goes from herself to the bodeket. But the woman, the chain of command is women come to the Rav, and the Rav sends to Bodeket. This is very important. If we have a Bodeket in our community, and there are communities that have Bodeket, and Crown Heights has a Bodeket, and Queens has a Bodeket, the communities have Bodeket, and maybe many other communities here that have Bodeket. And we know, and she appears on the shul list, and she appears on the shul magnet, and the WhatsApp. There's the Bodeket, and she has a share, whatever it is. It's very important that we should understand the chain of command is that the Rav can solve most problems without going to Bodeket. And the reason why that is important, for two reasons we said before, A, tircha. I'm not going to send every woman to Bodeket stam. And the other thing is that there are cases, and lo ma'at that this happens, that the Bodeket doesn't help the woman, she hinders the woman. She's not conducive to making a more Torah, she actually makes a more Tume'ah. That's very, very important. The second point is that the Bodeket has to maintain a connection with the Rav. The line of communication is when the Bodeket says information, that should come back to the Rav. Now that connection may be, as we said, directly with a phone call during the Bedika, or a phone call afterwards, or a letter given to the woman, but it has to be that the Rav can clearly understand the information that the Bodeket said. And therefore, the Bodeket must clearly report clearly what she saw. It has to be clear that this is what was not the woman's Torah. If I would get a letter from a Bodeket, or I get a phone call from a Bodeket, and I've had these situations, contemplations, that the Bodeket says, it's okay, Rabbi, the woman's Torah, I will say, that isn't what I want to know. Ze mamash lo matchil. She has to convey to me what she saw. That is the most important information. Then the question becomes, the Bodeket will say, can the Bodeket check a woman that didn't come from the Rav? Woman comes to her, can she check her? And I would say the answer is she has to be very careful to guide the woman. It's possible that the Bodeket will actually hinder you, make you not Torah, but in fact less Torah, make you more Nida, we want. And therefore, it is conducive and it is sensible to first of all go to the Rav. If the woman, for whatever reason, still refuses to go to the Rav, it is possible the Bodeket to check her, but having given the caveat that she may actually make him a situation worse. And therefore, the other thing is the Bodeket should be alerted, and if we have a Bodeket in our community, she should be alerted to the idea that it is important to notice medical conditions. That it should not be that a woman mistakenly thinks that if I went to the Bodeket and I found a petza, I am covered and there's absolutely no problem. And not only am I Torah, but I'm also healthy. Ze lo nachon. Ze mesukan. Because I'm giving a false impression, and sometimes we said a dangerously false impression that halacha and medicine are the same thing. Ze lo nachon. And therefore, in our guidance to Bodkot, we should speak about the importance of communication. We should speak about what it is that you want to see. So I don't only want to see pets, I want to see also that the secretion from the uterus was naki, was clean. That's very important. I want to, if you did a bedika, you should convey. Do I want you to actually put in a bedika cloth? Is it enough to do with a Q-tip? Is it enough to just look inside? Whatever it is that you're hold by halacha as a beseder gemor, there are different opinions on that. But it should be clear that Bodeket does what you say. And that means that if we have more than one Rav per Bodeket, the Bodeket has to deal with each Rav as that Rav requests. And one Rav will say, I just need to find a petza. Rav will say, I want you to call me during one Rav, and the Bodeket has to maintain that information and those communications. And it should be clear to the Bodeket that if she finds a medical problem, she needs to, what is the role that she has in conveying that information? That is the role of the Bodeket. That's the training of the Bodeket, the role of Bodeket, halachic basis of the Bodeket. I have two more points that I want to raise in the last few minutes that we have. The first is who has spotting. We spoke last time about Ktamim. Who has spotting? Who is it that suffers from spotting? So there are a number of women, and we misakem them in basically 4 different categories. One is hormonal imbalance. A woman has a hormonal imbalance. She has a drop of progesterone. Then she will see spotting, and you'll understand if we remember why the role of progesterone, we'll understand why is that the case, because progesterone maintains the endometrial lining. So if you have a drop of progesterone, that woman may see spotting. It's also true with other women who have hormonal imbalance. A woman who has PCO is more likely to have spotting. A woman who has endometriosis is more likely to see spotting. So that's one category. Women who have hormonal imbalance. The second category is a result of contraception. Oral contraceptives and IUDs will cause bleeding, or may cause bleeding, or are used to causing bleeding. Even if they've been there for a long time. A woman called me today, she has a Mirena, an IUD, a hormonal IUD that she's had for 5 years, and she started bleeding today, never bled before. I say, well, it comes from Mirena. She said, after 5 years? Yes, it can happen after 5 years. So the result of that, a woman's taking oral contraceptive. The woman today she was taking was such a balagan. She doubled up on packets and took less packet and she saw bleeding. It's very, very possible. A woman who took oral contraception for nursing and is now 8 months after postpartum, after birth, she has a little bit the level of her nursing reduces, and therefore she's more likely to see bleeding. So that's very common. That's the second category. Third category is the result of an abrasion. One has a petza, she can see spotting. One has an abrasion. Abrasion can be a result of hormonal imbalance. It can be a result of intercourse. It can be a result of her doing bedikot with fingernails. It could be a result of a yeast infection. It could be a result of other things that will cause an abrasion. Age will cause abrasion because a woman who gets older, she has less estrogen, and estrogen is what causes the vaginal secretions. And the fourth category is a result of fibroids, polyps, other things inside the uterus that are bleeding. These are 4 categories that we saw of women who spot. Women who generally spot will generally fall into one of these 4 categories. Either they have a hormonal imbalance, or they're taking contraception, or they have an abrasion, or they have something inside the uterus, such as polyps or fibroids. The last message that I want to say, and it's very, very, very important message that I think is we've spoken about it before, and we can't say it enough. And I know that everybody listening to this knows this 100%. But believe me, your balot bayit do not know this. The take-home message is women should not do unnecessary bedikot. And it's a very important message because the necessary bedikot may be going to a bodeket. The bodeket I put into the category of unnecessary bedika in many cases. If a woman sees a ketem on a devar shalom mekabel tuma, there is absolutely no reason to do bedika. The same reason, that same woman, there's absolutely no reason to go to a bodeket. There's absolutely no reason for the Rav to send her a bodeket. And so women say to me, I saw a ketem and I went to a bodeket. Bishima, what's the avamina? It's a Torah. But I know it's come from uterus. Asma, there's absolutely no reason in that case to do a bodika. And a bodeket is the same category as bodika. Bodeket and bodika are the same thing. The bodeket is basically giving me information I didn't know before. She's giving me a wider understanding of the world of bodika. And so it's very important that we, same way that we suggest not to go to bodeket, that we speak about don't doing unnecessary bodikot. A woman called me and she said, she called on a Friday, I remember it, and she said, I saw a ketem, and she starts describing the ketem, and it was this and that, and then I did a bedika. Why do you do a bedika? Why do you do a bedika? She said to me, you're right, that's what you told me last time I asked you. I said, you're fat, so you didn't listen to me last time either. She said, you gotta listen. Yeah, she did an unnecessary bedika. So that's very, very important to convey to people the importance of not going to a bedeket stam and not going bedika. Tov, we almost finished. I've just finished with one nice anecdote. Bedidi avi uvde. Was a man came to me, and I live in Modi'in. Modi'in, Baruch Hashem, we have a big range of Yidden, and many what we call here a light. So from some people this guy is a professional. He's light. He's not so from. But he Baruch Hashem keeps starting mishpacha. And he has, they had a couple of children, and he told me they were trying to get pregnant. And they had been waiting for a couple of years, maybe a year or so, trying to get pregnant. And he came to me with a bedika, Motzei Shabbat, sitting in this room that I'm sitting talking to you now. Maybe he was standing mamash here. Remember the story? That was yesterday. And he came with a bedika, Motzei Shabbat, Yom HaShvi. And there was blood on it. And I said, Saddam, and I really did not think it was a petza. And I said, load up, but what can we lose? I think you should go to a bodeket. I can't matir. I think you should go to a bodeket. If not, I can't. But I really wasn't convinced it was a bodeket. Sometimes you think it's almost 100% it's a pizza, but I just need a little bit of bodeket. I was very unconvinced, but I said, load up. I know I was very unconvinced he was going to go to a bodeket. She was going to go because they're light, they're not so from, and I don't know, you don't know what people are going to do. So he calls me on Sunday. And he says, we didn't go last night, but we went today. My staff name, I went to a bodeket, and the bodeket found a pizza. So Yom HaShvi was yesterday. Miss Yom HaShvi. You can go to mikveh tonight, Sunday night. Instead of go Motzei Shabbat, you went Sunday night. That month, they got pregnant, and 9 months later, she had a baby girl. Baruch Hashem. The girl's already now grown up. She's maybe 5 or 6 already. This is a few years ago. But I remember it was very significant to understand that there is a huge role for bodkot. So even though we say that bodeket is a very specific role, there is a role sometimes that we use a bodeket, and I think it's very important to the couple. I don't know, because you're going to go, it's your tircha, and maybe it's a waste of time, but there's nothing else I can do. That's the best I can do. So we spoke about bodkot, we spoke about what their role is, we spoke about what their role isn't, we spoke about a few maiselech. I'll send you the matzeget. Everything I said is on the matzeget, and you can listen to it, share again, together with the matzeget. You can see it with the PowerPoint, but it's pretty self-explanatory. And you have shailot, this is now the time for shailot, and if not, then Can
you just tell us again, Tommy, what was the story with the Bodekets made it worse? He said in the beginning, I forgot
a woman goes to the bodeket, and she has a ketem, let's say, okay? She has a ketem, and she goes to bodeket, and the bodeket sees blood coming from the uterus. But the woman's asura. Why? Because the blood comes from the uterus, and it's a sodoraita. So in that case, they made it worse. Had he come to me and asked me, it's a ketem on the vashalom kebel tuma, with pachot migris, I would say it's muteret, right? So going to the bodeket, that made it worse to make it better. Showing I just sent you the PowerPoint. I'm sorry about the I hope that the people in the accident are okay. I hope they will be okay. And B'ezrat Hashem, we should have a healthy summer. And I think that the following week, we'll maybe actually be giving the shir on the same time frame, because I'm going to actually be in America, I think, in 2 weeks' time. So, B'ezrat Hashem. So, Otovot, Tigers and Koltiv. Shalom, shalom.
Shikoach, shikoach.